Hello, and welcome to this UKFPO webinar about the National Foundation Doctors Presentation Day, and in particular, the winning presentation from the 2026 Presentation Day, which will come up later by Dr. Matt Emmerson. Welcome to you if you're listening or watching live, and welcome to you if you are watching a recording on our YouTube channel. If you are watching live, there is the opportunity to ask questions of myself and Matt, and please put those into the Q&A tab on the Teams channel. So it's a great pleasure to talk about the National Foundation Doctors Presentation Day 2026. The event is something that's been happening now for, I think this was the 17th version of the National Foundation Doctors Presentation Day. This was originally started by colleagues in the Seven Foundation School, led by Dr. Claire Van Hamel, who was Foundation School Director there at the time. It's an opportunity for foundation doctors from throughout the UK and Malta to present any work that they've done whilst they are a foundation programme doctor. Originally, the day was occurred in Bristol, in the Seven Foundation School, but more recently we've moved it around the country with events in Sheffield, and this year it was held in Southampton. So just a brief description of what happens on the day. We invite foundation doctors to submit any work that they've done as a foundation doctor. That may be quality improvement work, it may be research, case reports, and this year indeed we introduced an arts in the foundation programme category. We get a significant number of abstracts this year, over 900, and these are shortlisted by foundation programme faculty from throughout the country, and we're all very grateful to them for their work in doing so. The standard of the submissions and the abstracts is extremely high, and it's really a very difficult job to try and boil these down to just over 200 abstracts that are presented on the day. The top scoring abstracts are presented via oral presentation, as you can see here. This is this year at Southampton Football Club, and the various categories of presentation: quality improvement, case reports, research. And these are around 20 of these are presented orally during the day, similar to would be in other conferences. And I think it's a really good experience for foundation doctors to develop their presentation skills to a room of supportive colleagues and peers who will give them feedback about how they have presented. The majority of presentations, though, on the day are poster presentations, again, as I hope foundation doctors will go on to present throughout their career. And again, a very high standard of work of the posters that are presented by foundation programme doctors. And we ask them to try and precisely or concisely present their work in a couple of minutes to summarise it. And these are judged by, again, foundation faculty from around the country, so that we can come up with winners in each category. This year we had over 200 foundation doctors attend, and I hope that they found the day useful. And certainly the feedback we've had from foundation doctors is that it's a very enjoyable day. And certainly the team here, this is the UKFPO team and various other colleagues, also would say it's probably one of the most enjoyable days that we have in our foundation programme work. If I reflect on my time as a training programme director and then head of a foundation school, it's probably fair to say that very often the contact you have with foundation doctors is if they're struggling a little bit. One of the joys of the National Foundation Doctors Presentation Day is that you get to see foundation doctors who are really thriving, who've done lots of extra work during their programme, and have contributed indeed to better healthcare, whether that's through research, whether that's through QI, whether that is through case reports. And so it's a very joyous and fun day that we have where we see the great work that foundation doctors have been doing. In an effort to try and make the standard of work submitted as good as we possibly can, and as I mentioned, it is very competitive, with less than 25% of abstracts being accepted this year. We'd love to accept more, but of course we have a finite capacity with the venues that we have. But we do choose winners in every category, and this evening Dr. Emmerson from Oxford has come to present his work in this webinar. This is a picture of me presenting the winning certificate to him after the day, or at the end of the day, in January this year. And Matt is a graduate of Oxford from 2024, who did his F1 jobs in Reading and subsequently his F2 jobs in Oxford. And before Matt presents his work, we're going to just have a little chat about the sort of process of him presenting, of how he came to submit his work. So Matt, first of all, tell me how you first heard about the National Foundation Doctors Presentation Day, and what made you want to submit your work.
Yeah, sure. So I initially heard about the day through an email actually from our foundation training program directors. And the project that I'm going to present is a project that I was involved with during my trauma and orthopedics job back in F1. And I was sort of working on it a little bit and was looking for somewhere to sort of present it, and was really lucky that this email came out. And so I kind of looked and submitted, and very luckily got accepted, which was quite nice.
And how much effort, how much work did it put in to write the abstract for submission? Did you get any help from others, or did you how much time did it take to do so?
Yeah. So, to be honest, most of the work was already done beforehand, which was quite lucky. So, I'd done most of it sort of in the lead up to it. So it only took about maybe like half an hour, so 15 minutes to fully finish it off. I sent it off to sort of the consultants that I was working with and just checked that everything was okay, and then submitted it after. So it was a relatively quick process, to be honest with you.
And I think that's the case. If you're submitting quality improvement work, if you're submitting research, if you're submitting case reports, it will be very often work that you've actually already done, and it's just a case of distilling that into an abstract. I think it's a really important a skill to develop. Writing abstracts, it can be quite difficult to distill a complex piece of work into 250 words. But from my experience over 30 years being a doctor, including some time doing some research and then lots of presentations about stuff we've done in my unit, it's a really important skill to do, because that will be very typical. 200 to 250 words at any regional, national or international meeting would be absolutely standard. So it's a good skill to develop about writing an abstract in a skilled way, and getting feedback, as you said, Matt, from your supervisors, who will often, like me, will have done this many times, is a really good way of learning it. And as you say, Matt, your work was accepted, and not only was accepted, but yeah, you won the prize on the day. So I'm going to hand over to Matt now, who's going to do his presentation, and then a few reflections at the end on the day itself. Over to you, Matt.
Amazing. Thank you so much, Dr. Massing. I'll just share my slide very quickly. So yes, as Dr. Massing very kindly said, my name's Matt. I'm an F2 from Oxford, and I'm here to talk about my project that I did back as a foundation doctor year one, which is comparing artificial intelligence and the orthopaedic multidisciplinary team in the management of intracapsular neck of femur fractures. So as I'm sure some of you are aware, hip fractures are quite a common orthopedic presentation. When you're deciding the initial surgical management for this, a variety of resources can be used to guide this, including protocols, textbooks, and online resources. Now, in the future, artificial intelligence could be a useful tool in aiding this clinician decision making, and has actually already been investigated in other specialties such as the emergency department, general medicine, and radiology. Within these specialties, the artificial intelligence is being used for triage, diagnosis, and management to see how it could help there. However, minimal research has occurred in orthopedics as a specialty. As such, this particular project was looking to compare ChatGPT and orthopedic consultants in terms of their recommendations for management of intracapsular neck and femur fractures, and to assess the relative importance of patient-specific factors in this decision-making for ChatGPT. Now, a really important disclaimer before we start this talk is that artificial intelligence is not currently validated as a medical decision support system and has not been trained for clinical use. So this study and other studies similar to this are purely theoretical and preliminary and just used to highlight gaps within AI validation as a tool. Now, in order to carry out this project, we initially collected a cohort of patients who presented to the orthopaedic team with an intracapsular neck and femur fracture within an 18-week period. We collected a number of pieces of patient data, anonymized them, de-identified them, and created a standardized prompt, which we then inputted into ChatGPT in a closed chat system. Now, this specific prompt asked ChatGPT to recommend what surgical management they'd use to fix this patient's neck and femur fracture. We then compared the recommendations the ChatGPT said to what the orthopedic consultant decided in the trauma meeting. If there was disagreement between what the ChatGPT and the consultant said, we extracted the rationale behind why the consultants eventually chose that operation, generated the second prompt with this rationale and inputted it back into ChatGPT, and the revised response was recorded from that. Finally, in order to validate the model, we extracted data from 30 new patients. We extracted the same data, used the same prompts, and input it into the same ChatGPT chat box, and then again compared it to the consultant's decision at the trauma meeting as well. We used Wizard 2 and Jamovi for statistical analysis. Cohen's kappa was used to decide about agreement, and logistical regression was used to show factor significance. Now, on this next slide, we've got an example prompt of what we put into ChatGPT. So it shows the patient information that you would need in order to make the decision about what operation would be best, and then ask ChatGPT what operation they would use to fix this fracture in particular. So moving on to the results. For those who haven't seen the diagram on the left before, this is called a confusion matrix. And it's used to kind of assess the agreement between two different things. The important things we're looking at are the boxes in green. So if there's a bigger number in the box in green, that means there's greater agreement between ChatGPT and the orthopedic consultants. So in this first round, we had 105 patients included. There was initially poor agreement between ChatGPT and the consultants, with a Cohen's kappa of 0.03, and the top reasons for disagreement including the patient being more fit and mobile than ChatGPT thought, or extensive significant past medical history. So ChatGPT got it wrong both ways. Moving on to the second round, after a training round, as new information and rationale was put into ChatGPT, there was then very strong agreement between ChatGPT and the orthopedic consultants, with a Cohen's kappa of 0.93, and there was also a statistically significant improvement in this agreement in comparison to the first round. Now, looking specifically at the factors that were important for ChatGPT's decision-making, we found that increasing age led to a decreasing likelihood of having a total hip replacement versus a hemiarthroplasty. And this is actually very similar to what the orthopedic consultants demonstrated in terms of what factor was significant for their decision during the first round as well. However, as we move on to the validation round, with this new set of patients, we found there was only fair agreement, with a Cohen's kappa of 0.29. And importantly, there was no significant difference in the agreement in this validation round in comparison to the very first round of ChatGPT responses. So in conclusion, ChatGPT did not reliably replicate orthopedic consultant decision-making for intracapsular neck and femur fractures. There was initially poor agreement between ChatGPT and the consultants. This agreement improved with the additional information, but the improvement did not persist when it was validated on a new sample. Now, to clinicians unfamiliar with AI behavior, this transient increase in agreement could create the false impression that the model had learned from the feedback. However, the drop-off in agreement in the validated sample strongly suggests that there was forced alignment of the recommendations that ChatGPT gave us regarding the hip fracture management. In other words, the model simply agreed with anything we said without actually learning from it during the second round of responses. Now, this key finding underscores two significant risk factors regarding the use of AI in healthcare settings. The first is lack of explainability. Now, this is the inability of users, i.e. us, to understand how AI uses our inputs to generate the outputs it gives us. This means that when an output is formed, we have no idea whether the output generated has used clinically validated reasoning or spurious reasoning. Now, the generation of false information and false reasoning, which is not evidence-based, is known as hallucinations. And this is a second risk of using AI, as it's very dangerous for patients, can lead to completely the wrong diagnosis, triage outcome, or management if AI uses non-clinically validated reasoning. Now, this risk is especially great for more inexperienced doctors, such as myself, foundation doctors and other trainees, as it's more difficult to spot errors in reasoning if we have limited knowledge of the specialty, the condition, and the further management which would be indicated. Now, moving on to specifically the limitations of this study, the main limitation was the possible constraint of ChatGPT's responses. Now, as you saw from the prompt, we specifically asked ChatGPT to use NICE guidelines in terms of the recommendations which it would give. Now, NICE guidelines heavily recommends either total hip replacement or hemiarthroplasty for fixing an intracapsular neck and femur fractures. However, we found that the orthopaedic consultants also recommended dynamic and cannulated hip screws to fix the fractures in these patients. Although they're not specifically recommended in NICE guidance, they have been shown to be clinically validated for treating this condition in other studies. Thus, by trying to focus ChatGPT's use clinically validated sources, we may have inadvertently restricted the responses which it could give during the first round. Following on from the study, we would strongly recommend using new clinically focused AI models in further research, such as Open Evidence, which has been endorsed by New England Journal of Medicine. It would be useful to see these used as adjuncts to help summarize the evidence, and then have the clinicians as the final decision maker, rather than AI providing the definitive management decision for patients, and then to investigate whether this helps improve outcome for patients or adherence to national guidelines. Furthermore, given that AI is likely to become ever present in our working lives, it would be useful to understand current AI literacy and education in healthcare professionals, how it's being utilized, if at all, and how it could be safely implemented to reap the benefits of AI while retaining the importance of patient safety. Now that's the end of my presentation, but I just want to round off with a little bit of advice and reflections from my time presenting at the National Foundation Doctors Presentation Day. So as I mentioned in the beginning, the really most important thing I'd say was keep an eye out for any emails or opportunities. I didn't realize that this was a conference that existed, to be honest, until that email came out. So I'm really, really grateful that our foundation program director emailed it out to us, because got to have this amazing opportunity, which I'm really happy about. So that's really the main piece of advice that I would say. I would also recommend applying for study leave early, and you can also get it out of your study budget as well, which is really, really nice. So I'd really recommend doing that. In terms of if you're lucky enough to get chosen for an oral presentation or for a poster presentation, I'd really, really recommend practicing to time before the day, because as Dr. Masling was saying, there's quite a short period of time for both the posters and the oral presentation, so it helps to kind of alleviate any nerves during the day. And for me personally, I found that the questions are normally the most boring parts in any sort of presentation, so I try to prepare some answers for any sort of questions that might come up, and I'd recommend doing that if anyone was also similarly worried about that too. And then finally, I'd say, I guess the most important thing is to enjoy the presentation day. I've really, really enjoyed the day. It was a nice opportunity to meet a lot of people that I hadn't seen for a long time for medical school. So yeah, thank you very much.
Thanks, Matt. A lovely presentation of a fascinating subject. And certainly, if people watching have any questions, then live watching, then please put them in the Q&A tab. And I think you make some really important points. Again, thinking of this as a conference in itself, and that's great, but also as really good learning and preparation for the rest of your career. Whereas no doubt, as a successful doctor, you will go and present again. That is inevitable. That's something. And all the points you made about preparation, sticking to time, thinking about questions that may come up, are all really, 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 really good ones, because again, they will all hold you in really good stead for the future. In terms of using the fact that you've had the presentation and done this webinar, how might that advantage you, do you think, in the future?
And sort of having done the presentation, I think it's definitely useful for like having the opportunity to present to lots of people in person. So, I mean, that's quite a rare opportunity to present to so many people, sort of with information, with presentation that you've done beforehand, and also to do so like with quite a sympathetic audience, which is quite nice. It's with a lot of foundation doctors, with a lot of like consultants who are there to kind of support your work. So I found that was really, really useful, sort of for future learning with that.
Yes, and it is a very supportive atmosphere and culture there on the day of people who really want to try and support you and help you in what you're doing. Although as always when you're doing presentations, there are some fairly left field questions, and they're the good ones that challenge you, aren't they?
Yeah.
To try and think about that, try and think about what you're doing and think more widely. It strikes me that in terms of the presentation that you did, it would have been successful because it's about a common problem. We know that total hip replacement is probably the most common orthopedic operation, I should imagine. I'm not an orthopedic surgeon, but certainly in my trust, it's the most common orthopedic operation that they do, and they do lots and lots of them. So it's talking about a common problem is always very helpful. But then also something very up to date like artificial intelligence, which is obviously going to be here in your career, in my career, or what's left of it. It will be a really important part of it. So capturing something that's common but also advances in that is very, very important. And I suppose a first question about your presentation is, how did you get involved in this originally? As you were doing your orthopedic F1 post, there's lots of them around, but how did you get involved in that project? 'Cause I suspect there's pointers for people there as well.
Yeah. So to be honest, I kind of got involved quite accidentally. So I was doing an on-call shift with a consultant and a registrar, and we were going around seeing a load of different patients and stuff. And a patient actually mentioned sort of AI and healthcare and stuff like that. And I don't know what happened, but I think the consultant and the registrar kind of had a little bit of a thought, and they were like, "Oh, that is actually an interesting thought." AI obviously was quite, at the time and still is, a very, very new thing, and we hadn't really thought about it that much in terms of what it could possibly be used for. And I think the consultant in particular was really driven to be interested in looking into the project, and kind of came up with the initial question. And we were discussing about it on the rest of the ward round, and he basically turned around to me and said, "Would you be interested in sort of taking this forward and looking towards like making a project out of this?" And I was like, "Yeah, it sounds amazing." And it was quite on the surface of it, sounded like quite a relatively simple question, but was quite an interesting thing to delve into. Like looking at the different factors, it's just looking at agreement between two different things, but seeing it on a much wider perspective, and sort of the wider implications of it is also an interesting thing to debate and think about.
I mean, there's a whole load of stuff in there to unpack. Did you have any? Were you an expert on artificial intelligence before all this? Before you got involved in this?
No, literally not at all. I did. Yeah, I've maybe put a couple of things into like an AI chatbot every now and again, but it was pretty minimal before this. So it was a lot of sort of researching different things and looking at current literature that was out there. And so what I was saying in the presentation, there was basically nothing on orthopedics so far. It was pretty minimal. Most of it them in other specialties. So it was quite lucky that it ended up happening on my TNO rotation. But yeah, it's certainly now going forward, it's been quite useful to know, because I feel like it is becoming more present in our lives, whether we like it or not. So it's useful to have sort of thoughts and feelings about it already.
Yeah, and that's an excellent point, is that all experts started as non-experts. Whatever I might be considered to be an expert on, at some point I didn't know anything about it. And we all learn as our careers go on. The explosion in technology in so many specialties over the last decade has made even, you know, grey-haired old men like me have to learn new techniques and new ways of using technology, and that's going to be important for the rest of the careers of everyone listening or watching. That you'll always continue to learn, because medicine, thankfully, doesn't stay still. Otherwise we'd be still using leeches and humors and things like that. So you know, but you started from a point of not knowing very much about it, and now you will know a lot about it, a lot more than me, that's for sure. And I think the second point I would make is it's a fantastic example, Matt, of where so that's how these ideas often come up. You know, we think of research or quality improvement as being the domain of people in academic centres, and of course they are very, very important. But equally, really good ideas will often just come from an individual patient. But what I would praise you for, Matt, is that you took that opportunity on. I suspect if there are any senior doctors listening or watching, they would probably say lots of times they've said to younger doctors, you know, here's a good idea to do for a quality improvement project or a case report or a piece of research, and people have nodded and said yes, and then nothing's happened. And actually, you know, what you have done really well is actually take that on and do it and make sure it has actually you know, gathered some steam. And in doing so, I guess you probably got some support from the consultant and other junior doctors, I guess.
Yeah, no, entirely. So the consultants were very much there, sort of helping review the methodology, obviously working out the ethics and sort of the approvals and stuff like that. And yeah, it was really useful to sort of bounce ideas off other sort of like foundation doctors with me, because it's I mean it was very new for everyone. No one really knew exactly what was going on with AI, and it's quite nice to have other ideas and inputs on it too. Yeah, it was really useful to have like a team around it, so it wasn't just me sort of writing the whole thing and doing it all.
Yeah, and research and QI, just like the rest of medical practice, nowadays is always done in a team. There will always be other people to as you say, bounce ideas off and help do some of the work, and it's really important to work with others and doing that. And I'm sure many, or probably the majority of senior doctors would probably want to do these sorts of projects, and because it keeps you stimulated, it keeps you interested, and we all learn through doing them. But often we need the hard work and the skills and the knowledge and the enthusiasm of younger doctors to help with the projects. And as I say, that's why I would, you know, what you did particularly well was actually do it, just carry on and get it done. And it's a really fascinating topic. I think one of the things that and you mentioned this right at the start, one of the things I find very interesting is that and I'd be interested in your thoughts on this, is that a lot of the AI companies have those disclaimers in that they have their clinical systems, but they say this can't replace the clinical judgment of a doctor. And indeed, in my specialty, diabetes, there's some sort of AI stuff coming in, but there's always that disclaimer. And do you think that will always be the case? Do you think?
I think that's a really interesting question, and I think that is sort of the big question to ask. I think at the current time frame and where it is now, I think it's quite a way off. I don't know about you, but I feel like as a patient, I'd want to have some other person or some other doctor on the other end who is making the decision, and I could like chat to and discuss it with, rather than just sort of like a machine on the other end. So I think sort of some of the main benefits of AI at the current time are looking more towards like summarizing the evidence, finding the evidence, and then pulling out different threads from that. But I think like the main thing is that the final decision has to be with a doctor, with a clinician of some kind. Now, whether that changes in the future, I don't know. I think it very much depends on trust, like how much people will trust AI and machine learning and that sort of stuff. And I mean, I don't know if I'm able to predict that far ahead into the future, I'll be honest with you. But I think in the current time frame, the best way, or the ideal way which it could be utilized, would be sort of the summarizing aspect and the pulling the key parts out rather than definitive decision making.
Yeah. And yes, and that was a very good part of your conclusions, really, that is where we are. But it'll be fascinating to see where we go over the next, probably, I was going to say the next decade, but probably the next few years, really, I think
Yeah.
is more importantly. But interestingly, if I reflect back on my career, there's been lots of times where automation and then machine learning and now artificial intelligence, and it will take the place of doctors. But I think the point you make about the fact that patients will always want to speak to somebody, I think is really, really, really very important. And until AI can take that on, then there will still always be a need for the patient consultation. And in many ways, that's why in our foundation program curriculum and all the curricula for specialty training, we still continue to emphasize the behaviors that doctors need to have, such as communication, teamwork, and leadership, as being really, really, really important. And those are really emphasized in our revised curriculum that will be introduced in August. These sorts of things will still be, will probably become even more important, because there will be some procedures and techniques and skills that will be done by AI or something like it, or will be automated, but people will still always want to talk to a human being, and I think that is really important. Any other takeaways from the day itself? Anything else of interest? How did you find we have plenary speakers this year? We had Professor Chris Whitty come and do a talk. Was that of interest?
Yeah, that was amazing. I really wasn't expecting him to sort of be there. I mean, I don't know. I imagine most people on this call probably have experience of like Professor Chris Whitty through sort of TV and everything that happened during the pandemic and everything. So I remember he gave a talk about specifically what factors he thought would be interesting and would change population health in the next couple of years. And obviously, given his experience during the pandemic and his current role within the healthcare service, I thought it was really interesting to hear his thoughts on that. So yeah, that was really interesting. Really enjoyed that. And then there were a load of other oral presentations and posters and stuff that I was sitting on, which were really interesting. I guess along a similar topic, I remember seeing there was a poster looking at using AI to diagnose pneumothoraces on a chest X-ray, which I thought was quite interesting. And there, even some of the poems will also be really interesting as well. There's one about sort of a person handing over from themselves as an F2 to an F1 and sort of the lessons and learning that they've developed over that year. So yeah, there were lots of very, very interesting things. And as I was saying before, and sort of another really nice thing was there were a lot of people I didn't expect to see there. So lots of people who I knew from medical school and from school and stuff who happened to be at the presentation, but didn't even realize we're going to be there. So that was a really, really nice opportunity
and that's a really important part of the presentation day. During COVID, we kept it going and we did it virtually. I can picture myself trying to find a plain white sort of bit behind me when because I was presenting all day, because in those days we right at the start of COVID we weren't really used to presenting virtually. And I can understand that virtual meetings have the advantage that people don't need to travel and accommodation costs and all those sorts of things, but I think the advantage of getting 200 or 300 fantastic foundation doctors into a room together to talk and network and as you say, meet up as old friends, which I know happens, is one of the great joys of the day, really. And in that, during the lunch break or the coffee break, if you just stand still and listen, there's a real buzz around. People often say that there's a buzz in a room, but there is actually an audible buzz of people chatting and talking and catching up and laughing, which makes it such a joy. And it's great that you saw a wide variety of work there, because I think that's one of the other great strengths of the day, is that there's such a wide variety of presentations, as you say, from things about AI through to poetry, is what makes the day such a joy. Matt, thank you so much. It's been great to hear your presentation again. You were a truly worthy winner on the day, and lovely to hear your reflections as well. So just to say that we are certainly going to do the National Foundation Doctors Presentation Day in 2027. It's traditionally held in January, and we aim to do that again next year. And we hold it in January so that the foundation doctors who have had their work accepted can include it in a specialty application in sort of November time for post foundation training. So that's why we hold it in January. I'm sure that there would probably be other times of the year when it might be quite a good time to hold the presentation day, but that's a specific time specific reason why we hold it then, so that people can include their presentations in their specialty application day. There's a QR code there for more information about the National Foundation Doctors Presentation Day. We haven't decided yet on a venue, but we aim to keep moving it around the country as much as we possibly can. So please keep a lookout on the UKFPO website for any further information. Please look out for emails, as Matt mentioned. We send out a lot of information about the National Foundation Doctors Presentation Day via foundation schools, so look out for emails from your foundation schools about this. The submission date for the abstracts is usually somewhere around October. Again, we will publish a timeline about that and give you plenty of notice of when that will be. We do have deadlines, so the abstracts need to be in by a certain time and date. And again, that is in keeping with every conference that you will ever put an abstract to in the future, that they absolutely keep to deadlines. And my advice to you is if you're going to write an abstract, get it in as soon as possible. I can say now that the abstracts will be, same as last year, will be 250 words. So you might even want to start thinking about preparing something now, so that when the time comes to submit, it's nice and ready. But we'd really, really encourage you to submit any work that you've done. And I look forward to getting lots and lots of abstracts to shortlist later on this year. So I'd like to thank the UKFPO team as ever for their expertise behind the scenes, in particular James and Kata, who have been doing all the hard bits this evening with the tech. Again, I'd like to really thank Matt, and I'd like to wish him all the best for the future for his future career, and I have absolutely no doubt he'll be a success in whatever he wants to be. Thank you very much to those of you who've watched. There's a QR code there for our Humans of the Foundation Programme ebook, which we published in the autumn of last year. And it's something that I would heartily recommend reading. But I wish you good evening to those of you who've been watching, and I hope it was enjoyable for those of you who've watched the recording. Thanks very much for your attention.